Most knee problems that come into us as remedial therapists involve the patellofemoral joint. This is a joint where the patella or kneecap has to glide smoothly up and down over a groove in the femur bone underneath, and it's controlled by the quadriceps muscles. Common patellofemoral joint problems would include patellar tendonitis, either above or below the patella, problems with mechanical wearing of the cartilage underneath the patella, known as chondromalacia in younger people, which can develop into osteoarthritis later on, as well as problems with impingements of bursa, either over or below the patella. The key muscle group to look at with patellofemoral joint problems is the quadriceps. Quite commonly, the quadriceps are overused as part of the anterior chain. So if somebody has a weakness in the core stability muscles, most commonly the transversus abdominis, then rectus femoris and the quadriceps will be overused and potentially create problems at the knee. So when we're working the quadriceps, we want to start with a nice broad contact into the bulk of the quadriceps and just feeling for areas where it won't glide, the tissue won't glide as well. Most quadriceps problems tend to be located towards the outside. Vastus lateralis and the lateral portion of the thigh is involved in knee movement much more than the inside thigh muscles, vastus medialis. So tightness, as we can see with Chris here, there's quite a lot of bulk and tone on the outside, and this is likely to be where adhesions can develop. So moving from broad contact into more specific contacts, such as reinforced fingers, working slowly between fibres to remove adhesions, or the reinforced thumb works well. I can use some movement of the knee by using soft tissue release. So bringing in the thigh with the knee supported nicely over the top, I can sink into areas, particularly around close to the kneecap, that might be fibrous or adhesive. Sinking in with the thumb and using knee flexion to create a specific stretch. So with quadriceps work, consider their involvement at the pelvis. Are they being overused to stabilise the pelvis as part of the anterior chain? And start broad and then move into specific areas, and often you'll find these lie more on the outside.